foundations of maternity, women's health, and child health nursing. Hospital admissions. When we speak about hospital admissions, we know that childbirth is the leading reason that people go to the hospitals. It accounts for nearly 12% of all U.S. hospital stays. This is often how families initially start their search of researching hospitals and where they want to have their care. And most likely, whatever hospital a family chooses to give birth in will be the hospital they will remain with for the rest of their lives for any illnesses, admissions, or elective surgeries. There are various childbirth settings. Within a hospital, you will typically see a labor unit where you labor and deliver and then move to like a recovery or a postpartum area for the remainder of the days. Some hospitals do this all inclusively where they do a labor, delivery, recovery, postpartum room where you kind of do everything in the same room. They can accommodate cesarean births in OR suites, typically on the labor and delivery unit floor. You can also deliver outside the hospital setting in freestanding birthing centers. These are pretty common. In Ohio, we see there's one near the Amish community where they can use a birthing center in case of obstetrical emergencies. They have some technology at their hands, but they're also a little bit more flexible to deliver more freely the way they're used to as far as no restrictions of fetal monitoring or IV solutions, that type of thing. Or you can choose to deliver at home birth. A lot of midwives will do this and accompany people who decide to deliver at home. As far as outcomes management we're looking at, these are tools to decide length of stay for mothers and infants, and this is insurance driven. A vaginal delivery will typically have 2 days, and a cesarean section will typically have 3 to 4 days. This occurs after the birth of the child. So this does not include, the length of stay does not include the days, hours that you are laboring and delivering. Once you've delivered, the length of stay starts after that for your recovery period. Health statistically, we're talking about maternal and infant mortality. Mortality has declined dramatically in the last 50 years, and the United States does rank well below other developed nations for this, and infant mortality rates vary across different ethnic groups. Infant mortality is defined as babies who die before reaching their first birthday. So in Ohio, we rank 41st in infant mortality overall, which means 7.3 births per 1,000 live births where this occurs. And we do have one of the highest rates of infant death amongst Black mothers in the country. And Cuyahoga County specifically in 2019 had 936 deaths, infant mortality defined as babies died before the age 1. Infant mortality rates do vary in the United States, we said, amongst races. It is highest amongst Black infants. Secondly, then American Indian or Alaskan Natives, then white infants, and then lastly, Asian Pacific Islander infants. So that's just how it goes across the ethnic board. Most common cause of infant deaths last year were preterm delivery, preterm birth, low birth weight, sleep-related deaths. We call that SIDS, sudden infant death syndrome. We'll talk about that later in our, when we go over the newborn. Birth defects and other medical causes. Unintentional injuries remain the leading cause of death in children ages 1 to 19. So basically accidents. After a year old, accidents are the leading cause. Poverty is a major social issue. And there's questions about allocation of health care and resources. Do they have access to care? Are there government programs in place to help them? Are we giving care to the indigent women and children? And are health care rationed amongst all these groups equally? So why is there an increased risk? There has been a severe increased risk in the severe morbidity associated with pregnancy and childbirth. And why is this? One of the reasons they're looking at is inadequate health insurance. And we know we've talked about this politically for the past 2 administrations about how we can help make this health insurance more affordable and more equitable across all races, of all people. There is also an increased incidence of comorbidities, so other illnesses that pregnant people have, or I should say women have before they become pregnant, such as asthma, hypertension, diabetes, substance abuse. And this is especially among those low-income rural populations. We see a lot of these comorbidities, a lot of these women just not very healthy before they get pregnant. And then the last is the delay or denial of serious conditions or symptoms. And we'll cover this more in depth during high risk lecture, but this is just healthcare professionals not recognizing when certain conditions in pregnancy now become serious or life-threatening. So we talk about what the government can do to kind of help allocate the care, and one of them is WIC. And WIC is Women's Infant and Children Program, which is a federally assisted program for the health care and nutrition of low-income pregnant women, breastfeeding women, and infants and children under the age of 5. So there's a basic eligibility requirement that a family has to meet below the poverty level, and they will provide formula to these patients and nutrition for the moms who are breastfeeding or who are pregnant, and then again, this nutrition for these infants. When we talk about informed consent, we know that in order to give informed consent as a patient, you must be competent, you must have the full information of risk and benefits, you must understand what we're saying, it must be voluntary, and normally parents will consent for a minor child. So when we talk about what an adolescent can consent for, they can consent for treatments related to sexually transmitted diseases, contraception, and alcohol and drug abuse. However, they cannot consent for things in the hospital as far as procedures go. So for instance, if you had a patient who was 16 and pregnant, she cannot consent for herself as far as admission to the hospital, treatment, epidurals, or any kind of pain management, cesarean section. That still needs to be consented by her parent or her legal guardian. However, once that 16-year-old gives birth, she may consent for her infant as the parent of that infant. So it's kind of strange. She can't consent for herself for treatment, but she can consent for the baby once the baby's born. But she is still technically an adolescent in the eyes of the law and cannot consent for herself during treatment of giving birth. So what are the roles of the professional nurse? They're a care provider, they're a teacher. A lot of teaching goes on, specifically in postpartum areas. So if you are a nurse that likes to work with patients one-on-one, you like to educate, this is a good role for you because there's a lot of education that goes into being a new mom. So we have to educate about her body and changes and things to look out for, but lots and lots of education about how to take care of a newborn infant and what to look for and safety features. So we're definitely teachers in this role. We're collaborators. We work with our patients. We work with our doctors. We work with nutrition. We work with pediatricians. So there's a whole gamut of people we work with. Researchers. We're advocates, as always, for our patient, and we manage their care. Advanced practice nurses, you can have extended roles in these areas. You could become a certified nurse midwife. You could become a nurse practitioner, and these provide primary care for women and children.